Hello everyone. In this video, I'll be discussing on body dysmorphic disorder. I'm Rima Stanley, tutor at M College of Nursing. So at the end of this video, you'll be able to understand what is body dysmorphic disorder, what are the incidences, signs and symptoms, complication, risk factors, and also we'll be discussing few case scenarios. So, well, what is body dysmorphic disorder? So, before I tell you what it is, well, body dysmorphic disorder is a mental disorder which is actually been mentioned under DSM-5 under obsessive compulsive disorder related disorders. However, it is not being mentioned in ICD-10. So, what is BDD? It is a disorder which is characterized by persistent preoccupation with an imagined defect in appearance of self or in the presence of minor flaws. So persistent preoccupation, that means the person thinks about their flaws, existing flaws, or it can be even which is minor, or it is maybe non-existent. However, they are preoccupied about the symptoms, about those defects throughout the day and most of the days, and because of which it disturbs their daily functioning, socio-occupational, educational functioning, etc. So the incidences include, according to few of the findings, it shows that 1 in 50 people are affected with body dysmorphic disorder, and about 13% it's among the adolescents group or the students group who are affected, and 42% of this disorder is seen with atypical depression, and also they end up having anorexia nervosa, that is about 39%, and most of these people with body dysmorphic disorder end up undergoing cosmetic surgery, which is about 20%. Now, some of the common features that people tend to worry about include such as in the face, that includes the size, the length of the nose, the complexion of being fair or dark, wrinkles, the size of the lips and shapes of the lips, mouth, acne and blemishes. Then hair, that is its appearance, thinning or baldness, the skin and the vein appearance, the muscle size and tone. It's mostly seen among adolescent boys, where they are too concerned about their muscle development and their size. Genitalia, of course, it is seen both male and female equally. So what are the signs and symptoms? If you see, they worry too much about the specific area of their body, particularly their face. So, and they spend a lot of time comparing their own look with others, and they tend to repeatedly look themselves in a mirror and sometimes avoid mirrors. They also try to make a lot of effort to cover up all those flaws, such as wearing long sleeves, or wearing long pants, and also trying to cover up the defects in the facial area with the hair, etc. And also you find that these people have a repeated and frequent tendency to undergo plastic surgeries. Now, let us see what are types of BDD. Well, this classification is very loosely being categorized, mainly because the symptoms between these types does not really distinguishes between one and other, and most of the time the symptoms seems to overlap. So the classification or categorization is basically done based on the type of coping mechanism that the individual is using it. So the types include like BDD with eating disorder, BDD with self-injury, and passive BDD. Now let us see what is BDD with eating disorder. Well, Here, the person tries to control their appearance or look by losing weight. So, because of which the person tends to end up having either one of the eating disorder, that is anorexia nervosa or bulimia nervosa. So, in addition to just controlling their food, they also tend to engage in excessive exercises, etc. And the other typical symptoms that you would see with this controlling of food and weight leads to actually complications such as dehydration, inflammation of the bowel, frequent dizziness and fainting, and thinning of hair. And also you also find that they have a tendency to skip meals and food and eating as little as possible in a day, and often they feel too tired. The next one is BDD with self injury. So here the main highlighting symptoms of include such as the person purposefully induce harm onto themselves, especially to the body parts where they are worried about. And this includes such as cutting oneself, pinching one's skin, scratching oneself with the nails or the objects. And sometimes in severe cases, the patient tend to actually inflict dangerous bruises onto themselves using tools such as hammers and scissors. And this wound tend to become septic. That's a complication. And this type of patient usually uses clothing to cover up their signs of harm, such as, like earlier I discussed to you, wearing long sleeves, turtle, neck shorts, and also full length pants. The other one is passive BDD. So in this form, the patient do not make any actually efforts to hide the flaws or find any alternative mechanisms for this problem. However, they tend to keep all these insecurities within themselves, and often they are withdrawn from people. And they generally land up having depression. Now, all these three types of body dysmorphic disorder we have discussed, if you see, the symptoms are very, very similar in both the genders. However, very few symptoms differentiates between men and women. And some of these variations, how to address this is, first of all, in female, the kind of symptoms expressed or seen among women is considered as Barbie mentality. And in case of men, it's called as Ken perception. Well, this name basically derived from the very famous dolls, which is made by a company in USA, which the entire world and society, their community, consider that these two dolls are the perfect people of the world, and every teenagers, both female and male, would consider to be like one of these doll. Well, the other differentiation is that mostly women are more obsessed, usually, refer the features such as shape, size, and color. However, men are more obsessed over building up muscle tone and, constantly working out for that. So for women, they believe like looking good is very basic social requirement. However, for men, they believe that the way they can, to look good is just a way to be successful. So they have a personal goal in, by fixing their appearance. Now, what are the risk factors? Yes, family history of body dysmorphic disorder, also people having obsessive compulsive disorder, definitely they have the tendency to have body dysmorphic disorder. And also people with negative life experiences who would have undergone such as childhood teasing about their size, colors, um, being extremely tall or short, etc., and neglect, abuse at childhood, perfectionism, who considers a person who wants to be perfect in everything, a societal pressure, uh, especially certain job that considers beauty as an important um, profile for a particular job, etc. And also the people around, how they see the need for beauty. The other comorbid disorders that can lead to body dysmorphic disorders are like anxiety disorders and depression. Well, the complications include such as landing up having major depression, mood disorders, suicidal thoughts or behavior, obsessive compulsive disorder, eating disorder, substance misuse, and also disfigurement due to repeated surgical intervention. So here is a case study of 28 years old married women who presented with an illness of 10 years duration, who had a repeated thoughts and preoccupation related to being short stature and also having facial deformity. So she tends to check the mirror repeatedly and seeks a lot of assurance about her presumed facial deformity and hide from others. So, on process, she started having decreased appetite and sleep, and she preferred staying at home mainly because she wanted to avoid um, people seeing her deformed figurement, and also because she doubted that people would actually mock her ugliness if she is exposed. And she was also critical towards her husband's look and felt that his face was too big. And she feared that her baby would actually share her physical ugliness. Because of which, although every woman would be happy during the pregnancy stage, but here she is in extreme fear that a child would get all those ugliness, and she tried to actually attempt abortion, which was unsuccessful. And at the birth of her daughter, she again indulged in a frequent checking and reassurance about her daughter's, assumed deformity of the face, and felt very, very guilty for the fact of passing ugliness to her daughter, because of which she even tried strangling her child, which again it was unsuccessful. So if you, in her history, there was no family history of similar illness. On general examination, there was no abnormalities in that female. And Yale Brown's obsessive compulsive scale, which is modified for BDD, showed a score of 32 for self and 30 for her daughter. And severity of illness scale showed score of 5, which indicated severe symptoms and functioning mainly with assistance. So Hamilton Depression Rating Scale showed 38 again, which shows severe depression. So the treatment which was given for her was TAP venlafaxine, 150 mg per day, which is it's antidepressant, and trifluoroperazine 10 mg per day, along with that cognitive behavioral therapy. So here is the result after 12 weeks of this therapy, where, as you can see, before the therapy and after the therapy, 12 weeks, what is the difference? Y box and for shows, after the 12 weeks, it shows 12 for self and 6 for daughter. Clinical global impression shows the improvement scale which is used, it was 2, which previously before the therapy, it was 5, which is showed severe symptoms. And HDRS scale, which was 38, now shows 12. So the conclusion was that her distress improved and she had only mild dysmorphic ideas after the 12 weeks of the treatment. So this indicates that a combination of psychopharmacotherapy along with cognitive behavioral therapy and reinforcement, positive body reinforcement is very effective. So the keynote, body dysmorphic disorder can affect both male and female, and the symptoms are actually similar for both male and female. However, the condition is seen more higher in female, especially among adolescents, but it is also seen in adults. The symptoms are same, like I said, both in male and female. So the treatment includes such as counseling, giving psychotherapy, positive body reinforcement. Okay, this really helps the patients. The reference is Mary C. Townsend, Psychiatric Textbook for Nurses, and www.dsc.org.uk. Thank you for watching this video.